Decision 2020, our candidate interviews this morning. We have Ken Leon Guerrero, Republican candidate, and Franklin Bunker Meno, Democrat candidate. Right now in the KWAM News Zoom room, he's the general manager of the Port Authority of Guam, Rory Respicio. Good morning, Rory.
Good morning, Chris and Bree and Jason.
Half a day. So I understand you guys had another positive over at the Port Authority.
Yeah, we had our 10th positive case yesterday. And I want to take the opportunity to continue to recognize the port employees who we've remained 100% operational since this pandemic, before, during, and we will stay open after. I want to also recognize Public Health, the Acting Director, Arts and Augustine, Annette Uggan, Dr. Bovitsky, Dr. Kaneshiro, and their team. You know, they really allowed the port to take on its own the contact tracing efforts. We reached out to them. They were encouraging. There's a CDC website that we went on to get certified. We have about 7 contact tracing individuals here at the port. I'm one of them. And so as an employee receives word that they test positive, they have about 2 hours to inform the safety administrator or myself of their COVID test. And then if they choose to tell their supervisor because of confidentiality and HIPAA, and if the supervisor is aware of that positive, the supervisor and the division head, they immediately talk to the employee. They start to ask the employee trace their steps. If they have the symptoms, and then when they test, it's 2 days prior of when they became symptomatic, or if they didn't have the symptoms, then there's certain protocols for that to determine who we identify. And so once the number of people are identified, they immediately get that information to HR and the contact tracing team. And I want to say within several hours, the employees who've been potentially exposed have been notified. Maintenance is notified so that they can go and do the deep cleaning. If the employee was at work, we have to wait 24 hours before the deep cleaning can occur. But in the case of our 8th and 9th positive, we had to move things around. The section that clears the paperwork before the containers are released, the tariff section downstairs, they actually moved operations into the boardroom. They were running that via laptop. And so the employees have been very innovative. We understand our responsibility here at the port. We understand our mandates to keep the port open. 90% of the goods coming to the island come to the port. And so we've just kind of been reinventing ourselves on a daily basis, understanding that we also have a responsibility, and we don't want to burden the public health employees. They're doing an amazing job given the resources that they have and the mandates that they have. And so at the port, we have 10 positive cases so far. All 7 have returned to work. 3 remain with mild to no symptoms, so we monitor them daily. We have 28,239 visits to the port clinic since we opened up. We have had tested 338 employees. And so we want to take this contact tracing effort. We reached out to the port users group, Joe Cruz and the different carriers, and they're interested in becoming contact tracing. And so we're formalizing those protocols to help them. We also are doing everything we can. We have the hand washing stations, the hand sanitizers. We communicate with our employees regularly. As you can imagine, crisis management, right? And crisis communication. The employees are rightfully scared. We don't know too much about coronavirus other than it doesn't discriminate. It's very aggressive. And so every time we have a case of a COVID positive, we do have some employees, wondering who they are because we can't really say who they are. But we just tell them, if you continue to wear your mask, wash hands, social distance yourself, you have nothing to worry about other than if you've been potentially exposed, then go and get tested. And Public Health has been able to have us test on a Friday or on a Saturday. And that they've been very accommodating because of our own operations. And so we've been having to be extremely flexible. But I'm happy to say that we're business as usual. and business as usual doesn't mean sit back and be complacent. It just means this is our new normal. And so we understand what the CDC guidelines are, and we understand what precautionary measures we need to take. We're following Governor Leon Guerrero's directives and public health directives, and suffice it to say, 7 months in, we're still operational.
For that new employee, that one employee that had tested positive, was it from working at the port, or was it through contact tracing outside of the port? Do you know?
So we're seeing the 10th case from an outside contact.
I see.
We're seeing the 8th and 9th case also from a outside contact. They live in this. They're from the same household, and so one of their family members got infected, and through contact tracing, they got tested, and they were deemed positive, and so that's how we got the information. Those employees were asymptomatic. And so, they come to work because that's what they do, and that's what we do. But then we saw in one case, I think it was the 4th, 5th, and 6th case, where there was a cluster at the port. And so through contact tracing, remember, we tested about 80 people at one time. And then from that test, we had one that came out positive. And then so we had to test about another 79 people also at one time. And so public health has been extremely diligent and able to accommodate us. And so our employees have to drive all the way to the northern satellite to get testing. Public health, they're not able to come here and take the test. So I'm also grateful to our employees who, without a doubt, they understand what needs to be done, and they go on their Saturday to get the test, and then they notify us when they got the test, and then they notify us immediately of the results. But public health also gives us a general listing of these are the numbers that we tested, and these are the number of positives, number of negatives. They don't share the names individually because of HIPAA, but then we rely solely on our employees, and they've been extremely honest and honorable about their situation.
The 13 that were identified as contact to the new employee that tested positive, everybody's getting tested, you said tomorrow. Are they all on quarantine at home?
No, they're all at work because they're asymptomatic. And I know this is the struggle, right? When the JIC puts out the guidelines, if you've been potentially exposed, you have to immediately quarantine for 14 days. We're following the CDC guidelines on critical infrastructure worker that says for as long as you're asymptomatic, you have no symptoms, for as long as you're not positive. Of course, if you're positive and you have a runny nose, even the slightest chance that you have a cough, our employees secure themselves immediately. This is why when a couple of our positive cases, we didn't have too much effort with contact tracing, Bree, because the employees were already at home. And so they secured on a Friday, and then by Monday they got tested on their own, and then they became positive. So there was no contact tracing in that instance, because 2 days prior would have been that Saturday or Friday if we want to be an extra day out of caution.
Are these 13 additional employees that were identified as contacts, are they all working in the same division, area, department at the port?
They're all in the yard. For this particular case, they're all the cargo checkers. But in our 8th and 9th case, we had one from admin and then one from the yard. Potentially it was almost going to be 3. So if there was a third one from that household that was positive, we were looking at as many as 90 people to be tested, because one was day shift, one was night shift. But because it was 2, only one individual from the yard, it came up to about 22 that we tested prior to the 13 that we're going to test on Friday, tomorrow morning.
All right. Well, thanks. I know every time we talk to public health, the port is always used as that shining example in terms of, implementing and establishing a contact tracing team over there. So thanks for always being accessible.
Well, we're really following what the governor, lieutenant governor is asking us to do. In addition to being in this COVID-19 environment and all the uncertainties, we're very comfortable and we feel very confident because we're following those guidelines and we do what we can. They've helped us to establish this pork clinic that's being run by public health and DOE nurses. So those nurses are certainly valuable in terms of keeping the supply chain going. And without that pork clinic and without the 28,239 visits so far, and these are visits from also our tenants, from customs, from CTSI, from all of the trucking companies. I keep using the example, and we see it where the trucker will park on the side, run into the port clinic with their car, get their temperature check, and then run out. So the port users group has been availing themselves to the things that the port's doing, because we all have a mission, and this to keep the supply chain going. And shout out to everybody. It's a very tough environment, particularly our public health partners. I know they get beaten up every day with contact tracing, but for what they do and how they do it, I'm extremely grateful and appreciative.
Well, thanks again, Rory, and prayers that hopefully everything turns out okay for
Thank you.
you. All right, stay safe.
Stay safe.
Yeah, hey, there's some virtual empanada in the Zoom room if you want to grab some on your way out.
I'll take some for the staff at the office. But I had my breakfast at Tendon Inda, that store below Pago Bay.
Yeah.
It's a really, really good place to stop by. The family is connected to Choti.
Yeah.
It's the Munya Barnes clan. That's
Right. We're going to send you a bill for that commercial, Rory. Right on. There you go.
Bye, Rory.
Good stuff. 8:18. Good morning. We're giving away pizza from Crust coming up later in